Welcome to our takeaway messages from the ISUOG COVID-19 webinar, which was first broadcast on the 17th of March. We heard first from Dr. Castelli, a virologist in the north part of Italy, which is the epicenter of the current COVID-19 outbreak. 25,000 cases to date, of whom 1,700 have died. That's a roughly 6% mortality rate, which is quite high by Singaporean and Hong Kong and South Korean standards. Many of the deaths were in those with comorbidities, and just under 80% were in those in their 70s and 80s. He made the point that COVID-19 is highly infectious among healthcare professionals. When testing healthcare workers, nasopharyngeal swabs may initially be negative. Once someone has tested positive, they're sent home and they can only come back to work after 2 negative swabs 24 hours apart. Next, we heard from Dr. Chan in Hong Kong. She told us about the organization and arrangement of services in her unit. Visitors were not allowed in the labour ward. All elective activity has been stopped, and there was an isolation ward for known and suspected cases. These measures have been so effective that the number of cases in Hong Kong has reduced very significantly, and they're considering relaxing many of these restrictions now. She had some useful tips for us. TOCC, Travel Occupation Contact, allowed triaging and screening of women when they came into gynae and antenatal clinics. She talked about the N95 mask, which is used preferentially and used throughout the day and only removed when a doctor or midwife or nurse goes home. She told us it was important to have an emphasis on communication. By that she meant WhatsApp groups and emails. It can be pretty dispiriting for doctors who are going home, having worked all day long, not being able to talk to their friends, not being able to meet their friends and colleagues. She told us something else that was interesting, which is the pregnant workforce continue in work in Hong Kong, in distinction to what is being suggested in several other countries. Dr. Poon told us about the China experience. In China, there is a case series of women who have had confirmed COVID-19 infection. In these pregnancies, there are 10 newborns, of whom 9 were tested, and all these 9 were negative. So that suggests to us that the vertical transmission is not proven. It may happen, but it's certainly not common. She made the very important point that these women had had delivery because of severe pneumonia, so they're very, very sick at the time of delivery. And the important point is that COVID-19 itself is not an indication for delivery or caesarean section unless a woman requires to be delivered for her own condition or because her condition is deteriorating. Ultrasound scans are also an issue. They should be left until the end of the list or clinic because the machine must be deep cleaned afterwards. Remember, it's the whole machine and not just the probe. We then heard from Dr. Lee in Singapore. She told us about healthcare staff. 3,500 in China were affected and there were 22 deaths, so just under 1% of healthcare workers died. That's dated to 24th of February. In Singapore, there are 226 cases and 5 healthcare staff infected, all of whom are in a satisfactory clinical condition. In none of these cases, interestingly, was transmission thought to be from the workplace. This data is to 16th of March. So that is pretty impressive. 5 healthcare professionals out of 226 cases of the condition in Singapore overall. She also talked about N95 masks, which filter out 95% of microbial particles. They can be hung up and left to dry afterwards. She drew attention to the major problems in her experience, which is a shortage of PPE and a lack of PPE training.